So remember, there's three components to an injury. There's subthreshold, then there's functional capacity, when there more and more cells are injured, that it actually impairs and alters a functional capacity. And then when more and more cells are injured, then it actually goes into anatomical failure. So what is causing this? This is the classic chiropractic fixation. So as we know in the 3 phases of healing, this is where your body is producing collagen. And that collagen's not as elastic. And where is that collagen? Well, it's all over. It's in the capsules. It's in the soft tissue, the ligaments, the tendons. It surrounds this whole joint. The soft tissue is surrounded. These hard bones are surrounded by soft tissue. And all of those cells, or not all of them, but some of them to some degree have been injured. Now, when those cells heal with less elasticity and less mobility, less strength, this is exactly what happens. You have a fixation. And this is what causes altered intersegmental motion is during the 2nd phase of healing, typically lack of physical medicine, especially chiropractic care, which addresses all 3 ranges of motion, active, passive, and the paraphysiological joint space. And remember, the paraphysiological joint space or joint motion is the most important motion because it gives the most stress. And remember, tissues heal based on stress, just like bones heal based on Wolff's law. Well, the soft tissue heals based on the piezoelectric law. It's where mechanical energy is transmitted into electrical energy, and that electrical energy stimulates cellular growth. That's the piezoelectric effect. Just like Wolff's law stimulates growth or resorption in the bone. So this physical energy in 3 areas, active range of motion, passive range of motion, and paraphysiological joint motion. And so it's the chiropractic adjustment in the paraphysiological joint motion that creates the most potential energy, the greatest kinetic effect, which has the greatest impact on healing. That's the power of chiropractic care with joint motion. And when patients do not receive that, they lose joint motion. And the number one ramification from loss or altered joint motion. It's mainly altered, not lost. Altered joint, like this motion right here is definitely altered and lost. And the number one ramification of that physiologically is osteoarthritis. Altered intersegmental motion produces altered biomechanics of joints. And that's the precursor to osteoarthritis, which is the number 1 disability in the United States, causing a massive amount of pain and suffering, affecting many areas of people's lives, to their personal relationships, their sexual life, their work habits, their sleep, their activities of daily living, bathing, showering, getting dressed, working in the garden, housework, landscaping. It permeates and affects them in many, many, many very important ways. So this is classically the second type of injury. It's past the subthreshold, but it's not past the anatomical failure. And that's where the vast majority of injuries are. And so when these tissues heal, when that collagen, that type 3 collagen, that weaker collagen that's not as elastic, when it heals and it into the capsules, the joint capsules, the ligaments and the tendons and the fascia and the muscles, all that, that's what causes these restrictions. And that's the classic chiropractic fixation. And that's exactly what you're seeing right here. You're seeing a classic chiropractic fixation that is healed permanently wrong. And we're going to suggest that this patient has passed the 3 phases of healing. And that's why I'm going to say it's permanently wrong. This is now a permanent injury. And how I would know that is they're out of the 3 phases of healing. That's how I can definitively call this a permanent injury.